Moving on to Chapter 16, Assessment and Care of the Newborn. The APGAR is named after Dr. Virginia Apgar, and it stands for Appearance, Pulse, Grimace, Activity, and Respiratory Effort. It defines how well the infant is adjusting to life outside the womb. Anything less than a score of 7, we should be doing some interventions. There is 2 points for each category, and there are 5 categories. They are done at 1 minute and 5 minutes. Unless we do not have a 7, then we keep going every 5 minutes until either the baby is pronounced or the baby gets the 7. Normal typical APGARs are 8 and 9 or 7 and 8. Usually the points are taken off for color because a baby needs to be completely pink to get the full 2 points. And remember, babies are allowed to have acrocyanosis. It does not indicate oxygenation, but it is just a normal finding. But they need to be totally pink to get the 2 points. And the heart rate just needs to be at least 100 for the full 2 points, rather than the 110 minimum that we learned. On pages 230 and 231, I would like you to just read the pages for the descriptions and the pictures. Some of these fade as the child grows. Some of them, especially the melanocytic nevi, if there are numerous ones of those, the doctor should definitely be made aware of them. Milia is just the little white bumps on the nose. We just leave them alone. Erythema toxicum neonatorum is just newborn rash. Fancy name for newborn rash. I would like you to read about the cephalohematoma and the caput succedaneum. The caput crosses the suture lines and the cephalohematoma does not. So the caput will be more widespread across the head and the cephalohematoma will be confined to a certain area. Both of them are normal, if you will, findings. Think about that head being squished during birth. They usually absorb within a couple of days. The fontanelles on the baby are very important. The front anterior one is larger and diamond shaped. The rear posterior one is smaller and triangular shaped. They are assessed continually until the baby goes home. They usually will close by 18 months of age. This allows for molding at birth and for the rapid brain growth that the child will have. They should just feel soft and flat. A sunken fontanelle could indicate dehydration, and a bulging fontanelle could indicate fluid buildup in the head. Respiratory rate should be 30 to 60 without retractions, no grunting, no nasal flaring should be noted. Babies can have apnea up to 20 seconds. This is normal in a newborn. No longer than 20 seconds, but they can just periodically stop breathing. Their heart rate is 110 to 160 and usually irregular. Babies should have bowel sounds, and like I said, they should have a void and a stool within 24 hours. Babies can have something called pseudomenstruation. It's where a little bit of mucousy blood might be noted in the diaper. It's a very small amount, and it's from mom's hormones. The NIPS, the Neonatal Infant Pain Scale, is a pain scale that we use to judge if baby is in pain because obviously they can't tell us. Typically, if the baby scores a 3 or higher, we have to take some kind of action, whether it's swaddling the baby, putting a pacifier in their mouth, up to giving them some Tylenol. And like adults, you must go back within an hour and recheck the pain scale. Question? Answer. Vitamin K, erythromycin, and Hep B, and H big if mom is Hep B positive. Those are the medications typically offered in the hospital to the newborn. Mom has to sign for the hepatitis B. She does not have to sign for the vitamin K, the erythromycin to the eyes, or the H big. The new Ballard scoring system is a way to diagnose how mature the baby is at birth. So if they think a baby is supposed to be 35 weeks, but the doctors are thinking it looks closer to 32 weeks, this is how they do it. Please look on page 239 and see what everything is doing. What is the scarf sign? Or what is the square window sign? It's very interesting. Like I mentioned earlier, baths can wait till the baby is at least 8 hours old. This book might say 2 to 6. Typically, I think we wait 8 hours in the hospitals. Some moms do not want the baby bathed at all in the hospital because they believe the skin has protectants on it. As a nurse, you must wear gloves on any unbathed baby because that is bodily fluid on the skin. HIV positive moms, babies are bathed in a special solution prior to giving any injectable medication. So no shots until the baby has had a bath because we don't want to introduce infection into the bloodstream. Before they go home, the baby is going to have a hearing screening. And they're going to have what's called a PKU. That is the newborn metabolic screening. They have to have 24 hours of protein feeding prior to the state metabolic screening being done. Otherwise, nothing will be reacting. If you haven't been exposed to anything, you don't know how you're going to react. So they have to have been fed for 24 hours before we do that. Even home births, the mom has to get the state metabolic screening done. The results are sent to the pediatrician that was identified by mom. The bulb syringe. We teach the parents how to use the bulb syringe. You compress the bulb, you put it in the tip of the nose or to the sides of the mouth, and then you release it. You can use it over and over. It can get washed in warm soapy water. Nurses are not allowed to trim the nails. We usually tell them to use a scissor when the baby's asleep. We leave the cord alone. We let it just be exposed to air. We're going to teach parents signs and symptoms of infection, especially after the circumcision or for the cord. They must have a car seat to go home, and they must know how to put the baby in it. No one really uses the Plastibell anymore, at least in the St. Louis area for the circumcision, but we're going to teach circumcision care, and that is just to fold a 2x4 with Vaseline or A&D ointment, something goopy like that. We just fold that over the tip of the penis for at least 24 hours. It keeps it from sticking to the diaper. It shouldn't be bleeding after an hour or two, and it shouldn't be very much blood. And moms and dads should be taught that if the skin starts going over the tip of the penis, that they do need to pull it back. Not hard, just make sure it is movable because it can get stuck up there again. Newborns should eat every 2 to 4 hours during the first few weeks of life. Breastfed babies usually on that shorter end, bottle-fed babies on that longer end. Infant cribs should be free of toys, loose blankets, no side rail covers, and no pillows. Babies are laid on their back to sleep. A ceiling fan and a pacifier in baby's room may help prevent SIDS. Babies do not need baths every day as it will dry the skin out. Sponge bathe until the cord falls off and the circumcision is healed using tear-free shampoo. When to call the doctor? after discharge. On page 243 it discusses it, but remember a temp is 100.4. Here's a question and here's an answer.